Hey, I'm Lara Phillips. I'm coming from Thomas Jefferson University in Philadelphia. I'm also the SAEM Wilderness Medicine Interest Group Chair, so we have our meeting tomorrow at noon, if you guys have time. And yeah, I'm going to talk to you about simulation models. So we had some really good lectures on ways to teach outside of PowerPoint, getting students involved in scenarios, very hands-on teaching, which we're going to get into this afternoon, and we'll get to practice some of these. So models essentially are conceptual or physical demonstrations, and they're really fundamental in science. They're great for interactive student environments, and they create a realistic feel in role-playing, which is one of the methods you can do when teaching wilderness medicine. It also allows an opportunity to practice procedures, so things that students might not feel comfortable. So I want to start with an example. Back in Residency, I was looking for a project to do, and I had a lot of interest in ophthalmology, and I remember thinking, matriculating students in emergency medicine, unless you take ophthalmology during medical school, don't have great exposures, are not comfortable with procedures, but about 1% of complaints are actually eye complaints that come into the ED. So I worked on making different models. So one is recognition of an open globe, Edelstein, where you basically have an injury to the globe that when you put the fluorescein strip across from it, you get this streaming down of the fluorescein. So how can you recreate this model because you don't have open globes that come in every day? So for example, we took a styrofoam head, took an eye from a goat or a sheep, a bag of IV fluid. You then take, does this have a pointer? No. You then take a lumbar puncture needle and you stick it to the side of the head into the back of the eye. And then you hook that up to the IV fluid. Sorry, I'm not sure where I'm supposed to click. Okay. And then you make a needle, kind of like a poke incision in the central visual axis. And then you add your fluorescein, swipe it across, and you get a Edelstein. And I have a video. Let me see if I can get it to play. So, relatively realistic. We also made models for foreign body and rustering. You take a nail grinder and you kind of flail little sparks towards it. And this can help you in foreign body removal because this does require a lot of dexterity. Tonopen sounds easy, but some students have never done one before they actually enter residency. If you take a Foley bulb and you stick it through the back of the eye, you can actually vary the pressure and you can practice with the tonopen and the Shiatsu. And then ultrasound. You essentially can do a whole bunch of things, and you make a little incision in the eye, you stick a little metallic foreign body in it, sew it back up, glue the deficit, replace in the head, and there you go. You got a little foreign body seen on ultrasound. Similarly, you can actually imitate a vitreous hemorrhage with paint that you wound up injecting into the eye, seal it shut, and there you have your vitreous hemorrhage. There's also, if you want to stay away from animal eyes and just do ultrasound model without it, you can combine glue, gelatin, and natural fiber with water, and then you kind of put it in a ping pong ball, and it will solidify into a fake ultrasound model eye. It works pretty well. So what makes a great model? It has to serve a purpose. So what are you trying to get across? In this case, I was trying to communicate with incoming residents to feel comfortable with certain ophthalmologic procedures. It has to be realistic and cost-effective, especially if you're going to be doing this type of simulation over and over again. Reproducible, and then in the case of wilderness medicine, transportable, because you'll be taking these likely into the field using in your scenarios and role-playing. So let's think of some models specific for wilderness medicine. We actually have all this material here if you guys want to play around with it, because you'll be making scenarios during the final activity, and you can feel free to use these. So airway emergencies. They arise in a variety of settings. tactical casualty and combat care, in-flight emergencies, anaphylaxis, and a lot of facial injuries. And you might not have access to advanced airway equipment. So one example is performing an emergent tracheotomy. And there's been some things on the news in different situations, either on planes or in this case a restaurant, where a doctor was on the scene and was able to save someone's life because they used a pen to perform emergent tracheotomy. The best thing was this article had how to perform a tracheotomy in 5 easy steps. So just make a little incision just around the cricoid thyroid membrane, 1 puncture in. Really, it's 2 slits. You go down vertically and then puncture in across, and then you stick your pen, essentially.
Unfortunately, it's not the actual procedure. This is cricoid.
They're doing a trach. So yeah, their landmarks are completely wrong. They actually are doing a tracheostomy. It's not easy, and it's not a tracheostomy, but it's not. It's a very quick emergent tracheotomy. You will not be doing a tracheostomy. So thank you, Hillary, for this idea. But if you have so take one of the little heads, and this is all very cheap equipment. You then use some, it's like a plastic piping with ribs, which simulates the trachea, ketchup, duct tape, a balloon, and Play-Doh. Make a little cut where the airway would be, insert your trachea, fill your balloon with ketchup or simulated blood, apply Play-Doh, and then duct tape for your subcutaneous tissue, and there you go. You have your tracheotomy model. Skin and soft tissue injuries. So this is one gentleman, actually, I took care of Nepal when we were working in a high-altitude clinic, and he's fortunately got better. His right leg has an outlined area. It's a little hard to see on the slide, but he had some significant soft tissue infection, cellulitis, and abscess. And there are a lot of challenges in the backcountry to this type of infection. It's very common. In a study done with Knowles, they found that skin and soft tissue infections were the second most common injury. There's a lot of issues with hygiene, and there's issues with wound healing. So in hypothermia, for example, you have myelosuppression, and at altitude it takes longer sometimes for your wounds to naturally heal due to the hypoxia. You may not also have access to antibiotics. So you can easily make an abscess model. Take your vanilla or chocolate pudding, depending on if you want necrotic tissue. Fill up a balloon. You can also put air in it if you want an air fluid level. Use your Play-Doh, apply to limb, and incise. I don't think there's sound on this, but it makes a really cool sound. And we have all this stuff here if you guys want to play with that. Trauma is very common in wilderness medicine, fractures and dislocations particularly. So at the end of my experience working in Nepal, there was an earthquake in 2015, and so we actually provided some disaster relief. And most of the places we were actually had some sort of clinic or materials we can use to cast people or splint them. But in a lot of places, you're not going to be able to do that, and you'll have to do improvised splinting. Now, a lot of emergency medicine practitioners are very comfortable with this. They may use this all the time. However, there may be people that work in academic centers and have orthopedics available 24/7, maybe rely on consulting, and maybe they would like a little bit extra practice in splinting and reduction. So you can make an open fracture. This is probably the more expensive of the equipment, is those gel slabs up there. They can imitate flesh, but they're reusable, and you can use them to mold to a variety of body parts. Then you take some sort of vase or mold, like the one on the left is a plastic vase, but you can also use candle molds as well, and then some sticks. You then melt the plastic slabs, place in whichever mold you choose, put your broken fracture in there, and you can see kind of the bone sticking out, and then it's good to go. So in summary, models are a really innovative method for enhancing wilderness medicine procedural skills, and they can improve the realistic quality of scenarios. And they're just a fun technique to help engage learners. So we'll definitely practice with them later. So thank you. Happy to take any questions. And we're pretty much done with our PowerPoints for today, and we'll get 10-minute break and then working on our hands-on small groups. Thank you.